Welcome everyone, herzlich willkommen. It is 11 a.m. in Berlin, it's 10 a.m. in the morning in Dublin and London, at 6 p.m. in the evening in Seoul, Korea. Thank you for joining us live today. The German National Academy of Sciences, Leopoldina, goes virtual. This is the first event in a new series, a new format entitled Leopoldina International Virtual Panel Series, organized by the Leopoldina's International Relations Department together with our global partners. My name is Lucian, and together with my colleague Christian, who is in Berlin, and with my colleague Isabel, who you cannot see, but she's in the background, we will be co-hosting this panel, which will be chaired by the Leopoldina Vice President, Professor Regina Rippan. Today, we will discuss the issue of contact tracing apps and COVID-19. And the question, are such contact tracing apps a promising tool in the fight against COVID-19 pandemic, which is affecting us all? Warm greetings to our panelists, to our four panelists joining us from Hamburg, from Seoul, from Dublin, and from London. Thank you so much for accepting our invitation and sharing your expertise today with us. Greetings to the numerous crowd participants who are connected live across the world and throughout the time zone. It's impressive how many of you are there and how many time zones we have. Before we get started, some very brief technical matters, and I pass the screen to Christian.
Thank you, and a warm welcome from my side as well. In the past months, we all got used to video conferences and webinars, so most of the features should be known. Today, we want to make the panel as interactive as possible. And after input statements from the speakers and a short panel discussion, we have reserved enough time to address your questions. If you wish to ask a question, please use the question and answer feature, which you can find on the control board in the lower part of your screen. Open the Q&A window, type in your question, and tap Send. We will collect all your questions, summarize, and feed them into the panel discussion. If you want to assign a question to a specific panelist, we kindly ask you to include the name. The chat feature is restricted, and you can switch the layout of your screen by selecting your preferred option. To do so, please use the button located in the upper right corner of your screen. After the panel, you can send us your impressions at internationalrelations@leopoldina.org. Thank you, that's all for now.
Thanks, Christian. And before we start the discussion, let me just briefly introduce the chair of today's panel. Regina Rippan is a German economist. She holds the chair for statistics and empirical economics at the Friedrich Alexander University of Erlangen-Nuremberg in Bavaria since 2005. Her research focuses on empirical economics, particularly social policy, labor market policy, and education policies. And since 2017, Regina Rippan is Vice President of the Leopoldina. Professor Rippan, it's a great pleasure to have you today with us. Thank you very much for chairing today's panel, and the screen is yours.
Thank you, Lucian, and thank you for preparing all of this. I'm looking forward to the experience and would like to welcome our virtual panel series members and everybody listening in from wherever you may be and whatever time it is on your watch. In times of COVID-19, when most of the global scientific exchange has moved into the virtual space, the German National Academy of Sciences Leopoldina launches a new virtual format, which we call Leopoldina International Virtual Panel Series. We hope to promote the global scientific exchange even in these times. It is organized by Leopoldina's International Relations Department in cooperation with its global partners. Here is some very short information on Leopoldina itself. Leopoldina is the world's oldest continuously existing scholarly society since 1652. And it has about 1,600 members from almost all branches of science and over 30 countries. As Germany's National Academy, it has been vested with two major objectives. First, to represent German scientific community internationally, and second, to provide policymakers and the public with science-based advice. Leopoldina is an independent body which elects its members solely on their scientific merits. When it comes to science-based advice, the Academy makes its own choice of topics and in some cases takes on suggestions from German authorities. Leopoldina has been rather active and vocal with respect to the COVID-19 pandemic. We offered 4 ad hoc statements with advice to German federal government, other authorities and the wider public. These statements addressed options for intervention, health-relevant measures, overcoming the crisis and exiting the lockdown, and medical care and patient well-being. You can find these statements in German and English language on our webpage at www.leopoldina.org/coronavirus. During the COVID-19 pandemic, mobile software applications have been developed worldwide. Such apps are part of a wider array of digital tools for the prevention and control of infectious diseases. The main aim of contact tracing apps is to identify persons who may have had physical contact to an infected person and thus may become infected or ill. Whilst such apps do not exclude the risk of infection, they can play a crucial role in the containment of the pandemic. In Germany, the official tracing app was released for download on June 16th this year. The authorities have opted for a decentralized data storage on the users' smartphones. The app has since been downloaded by more than 16 million users. Other countries took different approaches and developed centralized digital tracing systems using a variety of tools, including mobile device tracking, bank card payment information, facial recognition, and big data generated behavioral patterns. In this process, contact tracing apps have raised many questions from app development to ethics, privacy, and security, and about the app's effectiveness. Our virtual panel discussion now compares different national approaches and experiences from a scientific perspective. Now, I would like to introduce our 4 panelists and get the exchange going. Let's start with Professor Doug Leith. He's Professor of Computer Systems at Trinity College Dublin and founder of the Hamilton Institute at the National University of Ireland at Maynooth. Government and tech companies worldwide have been rushing to build apps, services, and systems for digital contact tracing in the pandemic. There are differences about technology and privacy. There are also concerns, particularly about the apps. The MIT Technology Review has put up a COVID tracing tracker website currently listing around 40 apps available or being developed. So my question for you, Doug, which are the main general approaches on digital contact tracing in international comparison, and how should we look on their performance, particularly the performance of the apps?
Thank you. Thank you very much for inviting me to take part today. It's an honor. So I've been, together with colleagues, I've been looking at the performance of the Bluetooth and also the privacy and security of these apps around the world, originally starting with the Singapore one. And it seems to me that there are 2 big issues, 2 big headline issues. One is the efficacy. Do these apps, do they work in terms of contact tracing? And what are they private? What are the privacy implications of them? And so taking those in turn, the efficacy, the jury is very much still out on that. The measurements we've taken and other people have taken that we've talked to suggest that the idea that these apps can reliably detect people coming within 2 meters for 15 minutes or something of that sort, there's a good chance that that's not true, that Bluetooth is not capable of doing that reliably. And so that opens the question of, and yet we still deploy these apps, of, well, what do we mean by the apps working? When I talk, I'm not an epidemiologist, but when I talk to people, they say that the real questions, that the 2 meters, 15 minutes guideline is just a guideline. It's very rough. That really we're interested in trying to measure risk of infection. and perhaps there's something more complicated going on. And the hope is that still the apps will be useful for that, even if they can't measure proximity reliably. And that leads naturally into questions like, what rate of false positives can we tolerate? Because if we do a catch-all setup where we catch everyone who's nearby within some bigger radius, then we generate many false positives, which places a load on the health system. And that's central to the operation of these apps. These are embedded inside the bigger health system, of course. And the other part is we should be taking measurements of these deployed apps to try and help us understand better what their efficacy. And I think those are two big questions that I don't see being much discussed in public, at least not in the conversations I'm seeing. And the other big part of this is around privacy. It's often couched as centralized versus decentralized in the media. But in my own view, I think that's probably a red herring. That's actually missing the point. It seems that the reality is that we have two choices. We can either go down the Google Apple route, and that's driven by the fact that Apple phones don't allow easy background operation of scanning of Bluetooth. And so if you take a different centralized approach, as the French have done, as the Australians, as the Singapore people have done, then they run into problems with iPhones. And so that's in all these countries, that's a substantial number of people. And so that drives you back towards using the Google Apple option, or else what the Singapore people are doing now, as I understand it, is moving towards using dedicated devices, bracelets or something like that. So those are probably the two real choices. And, in the slightly longer term. And coming back to that then, if we just think about the Google Apple apps which are deployed across Europe now, the one thing that really strikes me is that all of these apps really involve two components. One is the part that's written by the local health authority, so the Corona Warn app, for example, in Germany, and the other part, which is the Google Apple part. And the public health part receives a tremendous amount of scrutiny. They're very clean. When I look at them from privacy, they're beautiful apps generally. But the Google Apple part of that, which is doing a lot of the heavy lifting, has had essentially zero scrutiny. There's no public oversight of it. There's no data protection impact assessment. There's very little documentation. And that's very striking to me, that there's this big gap in the important part of the apps. Thank you.
Okay, thank you very much. May I ask two follow-up questions on this? The first one, you said there's a risk of false positives with the efficacy of this. Do we have any information on how likely it is to have a false positive?
So, not good data. So the best data I've seen is data we collected in public transport in Ireland. So public transport is an important use case for contact tracing apps, because there you could be spending a significant amount of time in the vicinity of strangers. And so manual contact tracing would not identify those people. And so we took measurements in buses and trams in Dublin. And what we saw is, because of all the metal and so on, we believe in the reflections from the radio that causes, that essentially there's no decrease in signal strength, effectively no decrease in signal strength with distance. And so everyone within about 5 meters, it's about random. Toss a coin whether you detect them or not. Yeah. So that's a very high rate of false positives you would end up with in public transport. That's like a concrete use case. When I look at other cases, part of it's a design choice, because you can choose how sensitive or not sensitive you want your app to be, and that's going to directly affect the false positive rate. But there's a lack of information around that, and it seems like a central question to me. Yeah,
that makes sense. Thank you. Let me now move to our second panelist, which is Professor Mounye Son. He is Professor of Public Health and Executive Director at the Institute for Global Engagement and Empowerment at Yonsei University in Korea. Korea has built its contact tracing years ago. From the outside, it seems to be effective in controlling and preventing infectious diseases. This system does not only rely on an app. Instead, it uses a wide constellation of data, for example, cellular GPS data, information about bank cards, CCTV footage, and others. Big data analysis is used in addition to the traditional tracing of potentially infected individuals. So, Myung-sai, how does digital contact tracing actually work in Korea? Why is it so fast and effective? And what is the public health added value?
Thank you. Thank you for having me here in this virtual space, and good morning and good evening. Korea has been using the country's advanced information and communication technology system to trace suspected cases or those who had been in contact with the COVID-19 carrier. Intense contact tracing effort helped to curb the spread of new infections and deaths since March. The Korean government developed a customized app for quarantined individuals and required them to report their health status in regular basis. In addition, the government analyzed aggregated location data to locate potential source of community transmission. But above all, the nation always placed the foremost priority on tracing infected individuals and also those who had been in contact with infected individuals. Previously, our experience, the 2003 SARS, 2009 avian flu, and especially in 2015 MERS outbreak, triggered a series of the amendment of the Infectious Disease Prevention and Control Act in the National Assembly, consensus with the ruling and opposition party with many public hearings. As a result of the revision, public health authorities can collect, profile, and share 7 categories of data that pertain to infected individuals or suspected cases as soon as an infectious disease outbreak takes place. These 7 categories include the first, the location data, and second, personal identification information, 3, health record, 4, immigration record, 5, card transaction data, 6, public transportation usage record, and footage from surveillance camera. In addition, the Korean government has established a unique smart quarantine system to prevent the rise of imported cases. A smart quarantine system also draws on power of information and communication technology to gather arrival information from countries affected by COVID-19. Additionally, such information is shared with the Ministry of Foreign Affairs, Health Insurance Review and Assessment Services, telecommunication companies, and the KCDC. The smart quarantine system monitors the health of the inbound travelers during COVID-19's incubation period. The KCDC also became the first one to utilize roaming data of inbound travelers from high-risk nations to carry out quarantine measures. The KCDC has the responsibility to share all data concerning infectious disease with central and local governments, national health insurance agencies, and healthcare providers. Based on this mandate and authority, in 2020, the KCDC launched the COVID-19 epidemiological support system for enhanced contact tracing. Whenever the outbreak of the serious infectious disease occurs, the Korean government needs to instantly publish information on the internet or write a press release. When sharing information, the government needs to specify the path and means of transportation of infected patients, the medical institutions that treated infected patients, and the health status of those in contact with the patient. But to protect privacy, the sex, nationality, age, and name are not revealed. As COVID-19 has a unique feature, the response has to create an innovative while also harnessing traditional method. Innovative measures include drive-through screening clinic, a smartphone app called Special Immigration Procedure, and the treatment center for patients with mild symptoms. Operating treatment center just for people with mild symptoms has been effective in managing workload for healthcare professionals. If we didn't separate them and had put all patients in hospital, the healthcare system would have suffered from overload and eventually collapsed. The current prevention and control system based on the quick and extensive testing was also possible because we had a head start in testing kit development. We were able to quickly develop diagnostic kits thanks to early and proactive consultation and cooperation with the private sector. Also, we're making a public-private partnership for every kinds of combating activity with the COVID-19. Thank you.
Thank you, Myung-Sai. Can I ask one short question on follow-up? There is a lot of information of every individual that is collected. And I wonder if individuals have the right to not provide that information. How much is it mandatory and how voluntary is it in Korea?
Actually, during the enactment process in the parliament, in the National Assembly, we discussed that part very seriously. But if the people at the risk of infectious possibility of infectivity, so we can allow to them to use that. But if he or she wants to, do not give their information, that is allowed.
Ah, okay. So it's not mandatory. Mm-hmm. Thank you. Now I would like to move on to our third panelist, which is Professor Sir Jonathan Montgomery. He is Professor of Healthcare Law at University College London, Chair of the Oxford University Hospitals NHS Foundation Trust, and Non-Executive Director of Health Data Research UK. Also, he's the Chair of the Ethics Advisory Board of NHSX. In England, persons tested positive for coronavirus are contacted by NHS contact tracers based on an analog tracing approach. The authorities have worked on tracing app. Initially, they took a centralized approach on data storage, allowing for in-depth analysis. But since mid-June, the decentralized app model seems to be preferred in England. However, the UK has not rolled out an app yet, but has only tested a prototype on 2 British Isles. Jonathan, which strategy does the UK take on digital contact tracing for the COVID-19 management, and what are the pros and cons of a centralized data storage?
Thank you very much, and good morning, everybody. Simple questions there. So starting perhaps with where we are in the UK, we've signalled a shift of our focus from what started off as a focus on a standalone digital product to essentially a human service that we still think may become digitally enabled with an app to support it, but that is an open question at present. The main reason why we made that shift was that we couldn't make our app work effectively, picking up some of Doug's points. But I want to talk more about the shifts in the way we have understood the ethical issues and how they're framed. So when we started, we looked at the comparator in relation to the sort of app that we've just heard about. So we asked ourselves whether we should use geolocation, personal identifiers, whether we should link different data sets. And we decided not to go down that route in favor of more privacy protecting strategies, random identifiers, making sure that phones only shared contacts on the trigger of either reporting of symptoms, and I'll come back to that, or a positive test. Our debate has shifted from that into a debate about so-called centralized and decentralized. And in that context, of course, the app that the NHS was developing looks to be less privacy protecting. But behind the framing of those choices was an assumption that digital contact tracing would work, and that the only issue was the method that we chose. And the public debate has picked that up, but of course that is an assumption that we may think is deeply problematic. So the Ethics Advisory Board to the app considered that the key ethical question needed to focus on the value proposition for the app. Did it offer sufficient net benefit to individuals and society? And in particular, would it actually help spread the control of COVID? We thought that is in principle compatible with a human rights approach, because what it basically asks is whether or not the degree of interference in privacy is proportionate in accordance with the law and necessary in a democratic society, to use the European Convention of Human Rights Article 8 framing, with a legitimate interest in protecting public health. And we said, well, that requires us to articulate the purpose, the value proposition, explain why it's necessary to go down this route in relation to other ways of pursuing the legitimate aim, and also to put in place appropriate legal governance, which we've not done at this stage in the UK, but then we haven't deployed the app. But in relation to the centralized, decentralized question, we particularly focused on the challenge of COVID that comes from high levels of pre-symptomatic transmission. So we were interested in understanding whether it might be legitimate to trigger alerts to contacts on the basis of the experience of symptoms, rather than waiting for a formal diagnostic test. That would increase the number of false alerts, but if you could rapidly cancel them after a test, we might see significant containment benefits. So the ability to set up a system that would cancel alerts implied the need to have a system to know which firms have been alerted, and that was one of the reasons for being interested in a centralized approach. But with a big caveat that that could only ever be effective if we had in place sufficient access to quick tests and speedy reporting of results. We didn't have that at the time we were trialing it, and it remains a challenge in the UK, and that of course undermines the model of looking at a pre-symptomatic testing approach. But the bigger issue we identified about that related to issues around trust, and I want to also talk a bit about trustworthiness. So a digital contact tracing app needs to be trusted for two main reasons. One is we need lots of people to download it. The UK ruled out compulsion, although it has left the door open to some form of incentivization. The early evidence on downloads from our pilots is actually quite positive. That significant number of people trust the NHS brand and would be likely to download the app. As a proportion of the population, downloads on the Isle of Wight look to be higher than your 16 million in Germany. And that is an important part of the element. It's not clear to us how far privacy concerns about the app affect actual trust in the population, and how far it's the wider trust in government that is a key factor. But obviously, if we worry that people might trust it, we should concentrate on whether it's fair to ask them to trust that. And the Ethics Advisory Board suggested that we needed to be confident that an app was trustworthy before we invited people to download it. So the first element of trust is about downloads. The second element of trust is about behavior change. If we ask people through an app to change their behaviors, would they actually do that? And that was where we found that using symptoms as a trigger would not be trusted by the public. We were suspicious of that as an Ethics Advisory Board. Our public engagement work confirmed that. And that, of course, drastically weakened the interest in the decentralized approach. But that leaves open the question now whether it would be ethical to deploy an app based on a decentralized approach. And we don't yet know whether or not it's an effective and a proportionate intervention. We don't really know whether we are overconfident about our predictors of risk. So does it make sense to think about a 2-meter, 15-minute contact? Is that effective? We don't really know how we'll find out whether people follow on the advice that's there. In our original plan, the UK would have created an analytics environment that made it possible to track whether those alerted by the app were in fact more likely to contract COVID than not. It would also be able to track whether those people invited to self-isolate had fewer contacts in the future than before. And that might have helped us work out what the parameters for triggering alerts should be, proximity, duration of contacts. Now, if we can't have that analytics environment, it opens up the question whether it's ethical to deploy at a national scale what's effectively an untested intervention without any mechanism for assessing effectiveness for the purpose we've set it up and for monitoring adverse side effects. So it still remains a very open question whether the UK will go down that route. Thank you.
Thank you very much. This shows that the discussion is a lot richer than what we have found in the German papers. The idea of using the app already to test its own effectiveness, I haven't seen being discussed in the German framework. But maybe Professor Judith Simon can tell us more about this. I will now come to our fourth participant, which is Professor Dr. Judith Simon. She is Professor of Ethics in Information Technology at the University of Hamburg and member of the German Ethics Council. Germany's contact tracing app has been downloaded almost 16 million times, with numbers growing. The Corona Warn app was developed as an open source project and in the end took a decentralized approach. The use is voluntary and comes in addition to manual contact tracing at the local level. The app is now available for use in all EU member states, plus the UK, Norway, and Switzerland. Judith, what are major data protection and ethical concerns of digital contact tracing, and which role did these concerns play in the development of the German app?
Thanks also for inviting me. I'm very happy to be here. So maybe I pick up from a point raised by Jonathan before on trust and trustworthiness, because I think in the German context, there has been a lot of debate to what extent trustworthiness depends actually on privacy and security of the app. And there has been already in April quite a debate between two different approaches, which were also cast under the heading of centralized versus decentralized, despite the fact that none of them had like a really central server of all data, but it was rather the question of whether you have a central storage of IDs, of pseudonymous IDs on a server. And in that regard, there has been a turnaround in the German government towards this fully decentralized version where all the IDs, the temporary IDs, are just stored on the local smartphones. And part of the reasoning behind this was, so basically there may be two instances which happened which had an effect on this turnaround at the end of April. One was quite a number of academics, but also institutions such as the German Society for Computer Science, the KS Computer Club, and a number of think tanks made a public letter to both our federal minister and the Chancellor's office, arguing that we should opt for a fully decentralized version, the so-called DP3T approach in that context. And the government was previously pushing more another account, and they shifted as a reaction to that. But this is only part of the story. Of course, what also happened is that Google and Apple shifted what they have been proposing, namely that they would develop an exposure notification API only for decentralized apps, basically. And this is one of the problems which many of the apps which have not relied on the Google Apple account have faced, that they couldn't make it work, as some of the other commentators already said, because, for instance, the Bluetooth function was not happening efficiently. So in the end, Germany followed a very strictly privacy and security protecting account in order to develop its app. Initially, also the download numbers were very high. Now it's a bit staggering. So the question is also what needs to be changed, what we need to be changing now in order to increase the uptake, and not that it's sort of like staggering at some. There are some bug fixes that need to be done, some practical issues that need to be raised. And there are, of course, still ethical issues apart from privacy and security that we need to be facing. For instance, issues related to justice. To what extent can everybody use this app because it's not working on older apps that don't have a specific operating system? So to what extent do we either need to distribute mobile phones to those who don't have it, or bracelets or other types of things? So I think in terms of privacy and security as a precondition for trustworthiness of the systems, we fared quite well. Also in terms of transparency, because it is an open source project of a scale that was not really, I would say, heard of in the German context. So I think in that regard, that worked quite well. But there are still tasks to do also from the ethical side.
Mm-hmm. Thank you. Did you ever come across a discussion about evaluating the efficacy of the apps? That's what Jonathan was talking about as a concern in Britain. But I never heard a discussion of that in Germany.
Yeah, I mean, currently there are some numbers. I don't know how reliable they are, but I think it's about, we have around less than 400 reported cases to the apps. This would be about 20% of the actual cases in that period. So, so the question is really, to what extent are people reporting this? There's also the problem that you can't really report when you have recovered. So there's not even a function for that yet. So I guess, but this may be changing. And something that Doug noted, in many of these instances, when you want to change something, you're very dependent on Apple and Google making these changes possible. So this casts a lot of issues on, let's say, digital sovereignty to a certain degree. But I'm not exactly informed to what extent there are regular evaluations happening. I hope that they are happening right now.
Mm-hmm. Thank you, and thank you all for this first round. I would like now give the phone back to Lucian, because he has the data of our quick poll of contact tracing.
I don't have, thank you very much. I don't have the data yet, but we are going to start a very short opinion poll, which should go online right now. We would, yes, if you could please share your answers with us. They are all anonymized, so data privacy and protection is ensured, at least according to Zoom terms. And after 20-25 seconds, maybe wait 30 seconds, we will have the results. So the question is, are you using or planning to use an official COVID-19 contact tracing apps? We mean apps who are officially released by your authorities in your country of residence. So the poll is over. We have the following results. Yes, I'm using such an app, 48%. Yes, despite concerns and or unanswered questions, 14%. No, and I do not intend to use one, 12%. Not for now, but maybe in the future, 25%. So in first place, yes, I'm using. Second place, not for now, but maybe in the future. And now I go back to Professor Leith.
Thank you. Now, this is certainly a self-selected sample of individuals listening to this group. It may not claim representativeness for any population, except for the population of listeners and participants. Okay, so we can move on and address a number of additional issues. One point that I find very fascinating is the question about the role of Apple and Google, because apparently in different countries they play a role. I'm not sure whether they do in Korea as well, and whether they are actively involved in the app development in Korea as well. But maybe Doug, you mentioned the point first. How do you view the role of these two private businesses in this public health problem, in this challenge? We don't hear you.
Sorry, I'd muted it. I think it's a really important question, that I just don't see being discussed, and I'd like to see it discussed more. So what I see is maybe three different things. One is it's getting better, but back when I started looking at these things, there was essentially no documentation of what this software did. And so health authorities, like the health authority in Ireland, were being asked to trust Apple and Google that their software did what they said it did. There was little information on what it actually did. It was made difficult to test and verify, so due diligence was difficult, and that's how I started looking at this. So that seemed a poor start. So I'll be quite critical. Then during the course, so while on the 13th of June, while the app was live in Germany, the Google and Apple pushed out a major update to their part of the app that substantially changed its behavior. So it was the calibration values that changed, made a significant change to its behavior. We noticed it because we took measurements the week before and the week after and said, what's going on here, right? And so the fact is there's no supervision of that. Those companies can push out changes that will help affect public health, presumably, and there's no oversight, there's no opt-out, that's a worry, it seems a worry to me. And the third part is, particularly I've looked mostly at the Android part because that was to hand for me, but it's much easier to do testing on Android. The way Apple have done it makes it virtually impossible to do due diligence testing. So I'd say that's a serious criticism. So I'm not letting Apple off the hook, even though I've looked at one, mainly Google. Google have included, made a choice, because there's other choices possible, that their exposure notification services is included as part of Google Play Services, which is their proprietary closed source software that's used for many of their commercial apps. And that means that to use the exposure notification service, you have to enable this proprietary piece of software. Now that software, Google's business is collecting data to sell for adverts. And so that's what that software does. And so that's what our measurements indicate. We'll report on it in due course, but the very fact of enabling, being forced to, if you want to use a contact tracing app, you mandate use of Google Play services and therefore mandate this data sharing. And I don't see any discussion around that. That's why I was getting at that, the public health part of these apps it receives intense scrutiny, and there's a lot of open source, there's tons of, these very detailed data protection impact assessment documents that all the countries have released. And there's this void around the other half of the software that's not necessarily well behaved.
Mm-hmm. Yeah. Are there inputs from the other panelists on the issue of private business?
Sure. If I could put this slightly provocatively, we're dealing with two multinational companies, part of whose implicit mission is to undermine the ability of governments to govern. And we've allowed ourselves to get sucked into the privacy question dominating with very little discussion about effectiveness. The number of apps that are downloaded is in itself a performance indicator for this industry. Whether people use them afterwards and whether people keep them and whether they have a positive effect on society is pretty immaterial to the success of apps in this market. So it really does seem to me something we should be discussing very.
Mm-hmm. Thank you. Anybody else on this point?
Maybe just to briefly follow up on this, I mean, this is a major issue that at least also in research we've been addressing, to what extent basically through configuring APIs or to setting basically to being such powerful players you can't really work around. They have a lot of power to set standards, to either support norms, values and principles, or to undermine them depending on how they do it. And this is of course severely lacking in oversight. So while I'm applauding, of course, deeply applauding the public side being, so that we can scrutinize everything, that everything is documented and transparent, I would of course wish for more pressure towards opening the other side of that, right? But this is the question: which legal instruments do we also have to enforce this? To what extent, and to what extent do we also need to have? I mean, this is a big issue about, as I said, digital sovereignty. What do we have to do about infrastructures, about hardware, and all these matters in order to really get a bit back in control of our digital underground, if you wish.
Mm-hmm. Yeah, thank you. And it calls also for international cooperation. If Apple and Google deal with all countries and every country deals with Apple and Google by themselves, that's not necessarily an efficient approach. Where do you see the need for global or supranational coordinated approach, also in terms of developing the apps themselves? Where, in your perspectives, are the key challenges? I don't know, Doug, do you have a position on this international cooperation?
Only maybe two obvious things. One is interoperation as people start to travel again. It seems an open question. It's particularly a question here in Ireland, where there's a land border in Northern Ireland, with an open movement of people, and that's a very natural thing. the other is I see it seems very strange to me that every country is going to develop their own app again and again and again as an exercise in how you can use different software frameworks and approaches to implement the same functionality. It's kind of interesting. Maybe I'll use it with students, but it seems kind of wasteful for sure.
Yongse, is there any discussion about international cooperation in Korea, or is everybody just happy doing it on a national basis?
Actually, because we will inevitably be faced with emerging and re-emerging infectious disease. The world needs to establish a new and applicable disease prevention standard for better management. So under the international regime of the international, I'll give you the different perspective. I'm talking about we currently have the international health regulation agreed by the WHO member state to ensure global health security. But the circumstances with the challenging and the combating COVID-19, WHO's, the IHL doesn't have some good action to prevent that part also. So one of the reasons why the world is having a hard time coping with COVID-19 is the kind of IHL's failure to address comprehensive issues. So it embraces some of this kind of possibilities. There are special migration procedures as well as procedure caseload reporting are not specified in the regulations. Go forward, the IHL should be revised that some improved based on recent development like the apps and some other environment challenging with the COVID-19. So I'm going to discuss with the future IHL for the global health security is very necessary from the international level, supranational level. And also there is some public-private partnership is very important to develop the open source, platform for the various purposes.
Mm-hmm. Yes, thank you. That's a point that we haven't mentioned before. In principle, every country has the same problem. There is a World Health Organization, and they should have a role, they could have a role in developing recommendations and standards also for contact tracing apps. But I'm not aware that any such discussion has been taking place, or can you correct me on this?
There was a World Health Organization working party, and they published a statement on the ethics of digital contact tracing app. It's covered much of the territory that we've talked about. So not on the regulatory side, but on the deliberation side, there is work at WHO on that.
And is it discussed in the countries? Does it matter for national decision making?
So I think it's a little difficult to tell because of the sequencing. So in the UK, well, strictly speaking, our app was being developed initially for England, and then discussion about rolling it out further. We were quite a long way down the track of our deliberations by the time the WHO statement came out, and we reviewed it sort of alongside our thinking. It didn't really change our course of thinking. If we were starting again now, it would be a feature. I mean, I think most of the ethics groups of various sorts across the world have ended up talking about the sort of things that we've been talking about, but it's quite interesting that different groups have done it. So my understanding in Italy is that it went to the the group overseeing the ethics of security activities, not to bioethics, for example. I think in Switzerland, they had a panel which was a scientific panel as opposed to the social science and ethics panel looking at it. But they all seem to end up discussing the sorts of things that we've discussed in this panel today.
Okay, okay, that's good to hear. Now, maybe it's time to shift our focus to the questions from the audience, and I would like to invite Lushan or Christian to give us some information on questions coming in.
Yes, thank you. We have received quite a few questions, and it's great to see the engagement of the participants throughout the discussion, so thank you for that. Perhaps 3 questions for now. First, how many people need to use a tracing app to make it effective? And is there research on who is already using the apps, like younger versus older persons, or does the education level play a role in that? The second one, what is the actual health benefit of a Corona app if there is insufficient capacity for testing and treating, or when political leadership or other groups don't take the COVID-19 pandemic seriously? And a third one, it's more like a comment. Someone wrote, I don't have a problem with sharing my data because I use social media and lots of apps, and they all take my data. But can I decide on my own how this data is being used? Or is it just something that we need to get used to in the future?
Okay, thank you for these questions. The first one is an information question. Who among you has the answer? How many must use the apps for them being effective? And do we know anything already on the characteristics of people who are actually using the apps? Who has
so I can share some of the discussions we had in England. I think the feeling was from the modelling that was done by a group in Oxford who sort of prompted the English thinking about this. From memory, it was something like 40% of the population using it would have had a big public health impact. When you looked at what proportion that was of people who had smartphones, you got up to about 70%. And then when we discovered it only worked on some smartphones, of course, your take-up rate becomes a lot higher. But that was all modelling on it being sort of the only thing we were trying to use. When we began probing on what happened if fewer people download it, the modelling claim, and I stress this is about modelling, this is not about real use data, suggested that for every 2 people that download it, a transmission might be avoided. Now, I think we're getting to levels of detail that makes modelling very unreliable, but it built up 2 types of case for using this. One was that it might slow the spread of the disease across the community. The other is that it might not have a big community effect, but it might still be useful even if only a few people did it. And so that was the sort of discussion we had about it in the UK. We also discussed what you might call the digital divide equality problem. And I think there are a number of strands of our discussion on that. One is whether people get a benefit from a reduction in community transition. So if you work on very crudely the anxiety that many of the most vulnerable groups to COVID will also be the groups that don't use the apps. The claim that it's beneficial for us to use it as a society depends on those using the app reducing the spread, a sort of herd immunity type idea, from which then vulnerable people might also benefit. And we shouldn't ignore that argument. It's a reasonable argument to have a look at. The other was about extending the technology, so discussions about how we could make available to people who were vulnerable and didn't have phones, smartphones funded by the state to do it. Now, obviously, we never rolled it out, so we didn't take those things through, but those were the sorts of discussions that we were having.
Mm-hmm. Thank you very much. That connects to what Judith said earlier about the inequity issues. Judith, do you have a response on these issues for the German perspective?
Yeah, unfortunately, no numbers. I mean, I personally don't have any numbers, I have to say. So it's merely about the same concerns and trying to make sure that, in particular, you don't have like bias not only based on affordability of having, you know, the most up-to-date smartphones, or at least somewhere it's working, but also to what extent do people of different languages have access. So currently, the app is being rolled out in more and more languages. So this is yet another issue but also whether the awareness may differ, whether those who are actually already more aware or more concerned are also those who don't download the app, right? So there may be a number of factors contributing whether or not people download the app or not. So if you're ignoring COVID-19 altogether, you may just as well, on the one hand, act less securely in the public, but also don't download the app. And of course, to connect this to another point, you know, this is not a silver bullet. So it's just one tool amongst many. So of course, it only works in conjunction to other tools, and is in particular through testing and other types of measures. So it is a tool serving other purposes, if you wish. And maybe just on one more point on whether actually you can decide how your data is being used. I think at least in terms of the German contact tracing app, you have quite a lot of control, because only very limited data is being, you know, everything is sort of centralized, and only at the point of time when you can report an infection, at that point is your data being released. So it's very limited number. In terms of all other types of apps that you may have on your smartphone, the moment you have a smartphone, you have in fact zero control about what's being happening. I'm very pessimistic about the amount of control you have in regards of what your data is being used for, because there's a whole market built upon just, you know, processing your data and sharing it with others. So so I think this has to be differentiated between specific types of health apps and other types of apps.
Mm-hmm. Thank you very much. Yes, even across nations, from what we heard, there are huge differences in terms of what amount of data is transmitted through these apps. When we look at Korea with the 7 groups of information packages, and for Germany, nothing is transmitted unless you have been infected and do it yourself. Then there is a wide variety in what these apps do. Maybe we address the second question. I would like to ask Myung-Sae about this. Is there a health benefit if there's insufficient testing and treatment? How would you respond to this second question?
Mm-hmm. Actually, I'm going to start with the first question. I don't know the actual number of the download their apps, but all confirmed cases and the suspected cases and inbound traveler from the foreign countries has to use their apps under the basis of the necessary, proportionate, and temporary, and the voluntary and take a consent. So almost every participant of the app, the using apps, is they send their messages every day. But the apps is developed by the Korean government, joined with the private sector and with the Korean and English. So it is very active with this using this apps.
Mm-hmm. Thank you. Doug, do you want to continue on this?
It's hard. I'm not an epidemiologist. It's hard for me to comment too much on it. From talking to epidemiologists, what they're suggesting to me is that 2 possible benefits are quicker contact with people who would also be found through manual contact tracing, but maybe it takes time to find their phone number and contact them, and the app might speed that up. And the other is finding contacts who you wouldn't find through manual contact tracing, so public transport and the like. But all of that seems to me to depend on a reasonably high uptake, because you need both people involved, both the infected person and the person who's been exposed, to both have the app on their phone. So for example, if it's 1 in 10 people have the app, suppose everyone has a phone, then you're going to end up with 1 in 10 of the infected people have this is back of the envelope stuff. 1 in 10 of the infected people has the app, 1 in 10 of the exposed people has it, so it's a 1 in 100 chance. So that's why you need these really high penetration levels, otherwise the benefit may well be quite low.
Mm-hmm.
There's also an implication about that in relation to the degree of control over data. So the more we allow people, if you like, to personalize the app and control how much data is there, then the less reliable it comes in terms of my trusting that other people are playing the game the same way as me. So I think, you know, the more I think that people might be selective about how much information they share, the less likely I am to use it, because I can't have confidence that everybody else is playing the game that I'm playing, and that's going to undermine the take up, and that undermines the usefulness of it in epidemiological terms. Even though we can't do the numbers, we can see the shape of the argument, I think.
Mm-hmm. Thank you. So, Christian, are there additional questions from the audience?
Yes, I would like to read them out. We split this a little bit.
Yes.
Maybe two a little bit provocative or controversial questions, but I mean, we should at least address them. There is a lot of discussion on the fact that there seems to be a competition between European states. I mean, this is now the European perspective on who has the greatest, the best app. And several questions were raised. Actually, this is not the right way to do it, because we see right now that people want to travel again and Europe is interconnected. So shouldn't it be a pan-European app? It was written like that. And shouldn't this be a prerequisite if you want to travel, if you want to go to a restaurant or on the beach? Mm-hmm. I just leave the first question and then I will say the second one.
Okay. Thank you. So then we do a round on this first question. What are the chances for having a pan-European app? Do you have any vision of this being developed? I'm rather skeptical, but I'm not an expert on the field. How would you discuss that? Jonathan?
I think I would say it's the wrong question, because the question for me is more like where it went on to in the restaurants and the beaches. So it's less about the technology of the app, about the way it is integrated into systems and what its implications. And I think we should be very properly nervous about mission creep. So as soon as somebody knows that my phone will either have a green, amber or red flag on it, depending on my risk stratification, that my employer can ask me to see it, and you're moving slowly into immunity-ification, which is scientifically, I think, very dodgy. So I think we could have a lot of discussion about the harmonization of the apps, but what would really make a difference to people is not the technology, but how it's embedded in our society. And I hear people very suspicious about interoperability seen as a technical question, and much more about a set of policy questions about who you let into the country under what conditions. So we might have the same map, but still discover that there are concerns about freedom of movement. Sadly, I speak from outside the EU now, but we can't have.
Mm-hmm. Thank you. So then we have to widen the question. It's not just are we able to develop a technological app that's used by different countries, but also can we see a process by which different countries agree on regulating what is done with the data collected by such apps? Are there any visions on that which goes beyond the first part? Is that a realistic option, or can we not hope for that? Judith, do you have a perspective on this?
Not more than an educated guess. I mean, just observing what's been happening so far with all the different developments, I don't think there will be an agreement, out front on deciding how to do this. There may be an agreement afterwards on sort of like, agreeing on certain standards. But I think also given the time pressure, waiting for an agreement on how this has to be done, not only within a country, but within Europe, would have taken so much more time that I think even, just from the time dimension, it was good to have at least something working, because even that took longer than necessary, right? I mean, the app came and on the market in Germany at a time when already the infections were going down. So I think it was a matter of speed, and whenever you have to reach an agreement, it takes more time. So I think from this practical matter, it was good that it happened the way it did. This does not prevent from some tool that has maybe good standards afterwards becoming dominant in the market, because other countries may simply adopt it because it gives them some certainty, some stability, something like this. Similar to, I mean, that may be not a good comparison, but also the GDPR is sort of like something traveling as a regulation worldwide, because it at least gives some stability. If it passes this test, you can also use it in other countries. So something like this may be happening. but I'm not entirely sure. But I would also be very skeptical, or not even skeptical. I would strongly oppose, to make it more compelling, any restrictions tied to using apps, right? I mean, there's a strong demand on making these apps voluntary. If in the end you link certain liberties or restrictions to the usage of an app, it stops being voluntary because there's an implicit pressure on using the app. So I think, if you wanna have this to be trustworthy, then it must be voluntary, and this is not only a technical matter but also something that has to do with the practices. So this may have to be regulated in the end, that private companies are not allowed to discriminate between those using the apps and those not using the apps. And the same also, of course, goes, as was said, with immunity certification or any types of other measures.
Mm-hmm. Thank you. Myung-se, in Korea, yes, you have such a long history with infectious diseases and developing these apps. How is it viewed? How do you deal with the risk that employers get the information? That should be very, very topical in Korea.
Yes, the computerization of healthcare record and healthcare history, it started with the 1977. When it started our health insurance, at the computer era is started. So every data was managed by the computer system from the beginning of the health insurance cooperatives. So we can collect many data of the healthcare institutions. So still, we kept over 300 petabyte healthcare usage for that. So if it is concentrated from the healthcare utilization, so we can use that kind of analysis. So also I think the question by the audience is the pan-European app or pan-worldwide app is the starting point we have to discuss with that area too. Also, everybody thinks it is skeptical, but under the regime of in the 2003, the SARS epidemic, in response to the SARS epidemic, WHO revised the 2005 IHR. But in the COVID-19's response to the WHO's work is the consensus, the new IHL, the revised IHL, with the participation of every government. So that IHL has to describe with what is the core component of every country's using apps or some other things to reporting standard and the reporting the document to their government from the provider to the local government and the government, and that should be using the app tracking apps and something like that. So I think we have to discuss with the possibility of that kind of endeavor, and also continuously discuss about the possibility of revision of the IHL with the next the WHO or United Nations or the G20 or some other
yes,
groups meeting.
Yeah, thank you. So maybe we check whether there are additional interesting questions from the audience.
There is one which is interesting, but I think we could make a separate panel on that. But it's just a lot of people were saying that basically, just let me look, these apps are only a piece of the puzzle. And they're asking the question, why should we have only apps if we don't have comprehensive digital tracing systems? Like, for example, in Korea or Singapore or China are the examples here. And when we do that, when we take this decision, isn't this the first step to a pre-stage to full digital control of individuals, or to a new type of citizenship, the digital citizenship?
Mm-hmm.
That's all from myself.
Far-reaching. So if we introduce Corona tracing apps, is this the start on our path to new citizenship? What's your position on this? It sounds like we are opening Pandora's box. Judith.
And maybe a short answer would be that depends very much on the specific technical details on how exactly you design the system. You have a whole spectrum of either making it very privacy preserving and very secure, or using more information, making it possibly more efficient if you also make it not voluntary but mandatory. So this is a whole spectrum that you can have, right? And at every junction, you have to make a decision how you implement this technically. What sort of governance do you have surrounding it? What sorts of regulation do you have surrounding it? And depending on each of these specific choices that you make, this either goes into the one direction of just being a tool that may be deleted afterwards, or being a first step towards further surveillance. And I think this is why all these also technical decisions have been fought for so hard, because they are implicitly also decisions about, basically what societies we want to live in. And so maybe that as a short answer possibly to that.
Mm-hmm. Thank you. Somebody else wants to make a point on this one? Jonathan.
So I think I agree with that, and I certainly agree that the detail of the design is really important and needs to be talked through very carefully. But I do wonder whether or not the social context in which we implement these things is a bigger feature of this move towards being controlled by our digital identities. And I'm not convinced by my colleagues, and some of them are quite close colleagues in my own faculty. I have someone who's pushing the DP3T as part of the design team on that and is lobbying me about that. I'm not convinced that better privacy protection built into the design protects us against this shift towards a different type of digital citizenship. So I worry that we have to think this through at all levels of the system and not suggest that it's a technical question alone, because it clearly is a technical question, but I also think it's a social question. And we could have a highly privacy protective app, but still have systems that expected people to show what it was telling people. And that could have exactly the same impact on our freedoms as an app that was designed to control our freedoms in that way if we don't regulate it effectively. So
Okay, so I think we have to come to a conclusion. I could continue discussing with you for a long time, but our time draws to the end. I would like to conclude our debate. We have had an interesting discussion about the different national approaches that were taken in different countries, very different experiences. We talked about the centralized and decentralized strategies, the role of data protection and privacy issues, but also about the challenges of equity. I found it very interesting to connect the introduction of tracing apps with an idea of evaluating and assessing their health effects. Judith pointed out this is not the silver bullet to bring us out of the pandemic situation, and we all have to take care that we are not generating the new citizen by introducing these apps. I would like to thank all the panelists for their input and their discussion. I thank the participants for attending and for asking questions. Leopoldina International Virtual Panel Series will continue in September. In COVID-19 times, when international travel is restricted and difficult, when in-person meetings have come to a halt, we want to continue this global scientific exchange. Even if COVID-19 right now is dominating the debate, other topics will remain important and need to be discussed by scientists in international comparison. COVID-19 is only one of the fundamental challenges of our times. So you're all invited to join our next panel, which will focus on mental health in the current health crisis, and which will be organized together with Leopoldina's partners from South Africa. An invitation will be sent out in due time. In the meantime, please follow the website of this virtual panel series for update and Leopoldina's official Twitter and Facebook accounts. Let me close with the historic motto of Leopoldina, nunquam otiosus, never idle or always active. So stay healthy, Thank you very much and goodbye.